Good day, everyone. This is Rana Zahrani, a fifth-year medical student from KSAU HS. I will talk about diabetes in multiple parts, and today we will cover diabetes part 1. These videos are mainly based on ADA guidelines, which is American Diabetes Association, published on 2015. The outline will be diabetes definition, then classification and pathophysiology for mainly diabetes type 1 and type 2, then symptoms of diabetes. So for the definition is we have a problem with carbohydrate metabolism. So when we have the metabolism is affected, we will end up with the hyperglycemia, which is high level of glucose. This is mainly due to two parts or two causes. The first one is insulin or impaired insulin secretion. So we have problem with the secretion itself, either relative, which is partially, or absolute, which means we don't have insulin at all in the body. The other part of the problem is we have peripheral insulin resistance. So we have resistance to that insulin if it's there in the body in different degrees. This can be together or one of them starting the problem. Diabetes mellitus is really a serious problem for all ages and in all countries. It affects about 5 to 10% of adult population, and it has increasing prevalence in case A. It has its own severity and complication that can reach death sometime. According to the latest WHO statistics, diabetes is the 8th leading cause of death worldwide, and it is the 5th leading cause of death in specifically KSA. Also, another problem with diabetes is that about 25 to 30% of people with diabetes are undiagnosed yet. Also, up to 25% of those patients who are already diagnosed with diabetes, they have already microvascular complication at the time of the diagnosis. So you can see that diabetes mellitus is common, severe, and can be undiagnosed or lately diagnosed in a huge percentage of people. We can classify diabetes mellitus into 4 main types. Diabetes type 1, type 2, and gestational diabetes, which is diabetes during pregnancy. Also, other specific types for diabetes due to other causes, like non-pancreatic disease or some specific drugs that can cause diabetes. In this video, we will cover and concentrate on the 2 main types of diabetes, which is type 1 and type 2 diabetes mellitus. So the 2 main types of diabetes that we are going to concentrate on are diabetes type 1 and diabetes type 2. Each of them we can find genetic component and acquired component. For genetic component or genetic predisposition, type 1 has stronger HLA association than type 2. For the acquired component, type 1, it is mainly about autoimmune process, while type 2 has multiple causes, mainly obesity and inactivity that cause or the cause beyond the pathophysiology of type 2. Let's talk more about type 1 or insulin-dependent diabetes, since they are mainly treated with insulin, so they are dependent on insulin. Previously, they used to call it juvenile onset diabetes, which is not correct anymore. Both types of diabetes can present at any age, but because of the stronger genetic association and because of the immunity process, many patients with type 1 diabetes present early in life. So they used to call it juvenile onset diabetes. However, diabetes type 1 can present at any age, so this is not correct anymore. Good number of diabetes type 1 patients, they present with acute symptoms of diabetes and markedly elevated glucose level. In fact, about 30% of diabetes type 1 patients, they present with diabetes ketoacidosis, which is a life-threatening complication of diabetes, which made several studies to suggest measuring islet autoantibodies in relatives of those with type 1 diabetes to limit or trying to limit acute complications. We can classify type 1 diabetes into two main subtypes, immune mediated and idiopathic. For the immune mediated, we have autoantibodies against or that interfere with the glucose control in the body. In type 1 diabetes, we have many autoantibodies. One of the most common is autoantibodies against pancreatic beta cells. So, in the body or pancreas specifically, we have many beta cells that produce the insulin, which control the glucose level in the body. In type 1 diabetes, we have autoantibodies against these beta cells, so some of these will be destroyed by these autoantibodies. At the beginning, the remaining beta cells will try to produce or secrete enough insulin to control the glucose. But with time, beta cells will be destroyed more and more by these autoantibodies until we reach a level that these beta cells cannot compensate anymore to produce enough insulin, and as a result we will have hyperglycemia in the body, leading to the signs and symptoms of diabetes. The rate of beta cell destruction differs from person to another, but when more than 80% of beta cells are already destroyed, the sign and symptoms of diabetes will appear in that patient. Type 1 diabetes account for about 5 to 10% of all diabetic patients. It has strong HLA association with linkage to DQA and DQB genes. As you can see here, type 1 diabetes has many autoantibodies. One of them is islet cells autoantibodies or autoantibodies to insulin, to glutamic acid decarboxylase, or to tyrosine phosphatase, also to zinc transporter 8. These patients are also prone to other autoimmune disorders such as Graves' disease, Hashimoto's thyroiditis, Addison disease, or celiac disease. ADA guidelines recommend considering screening those patients with type 1 diabetes for other autoimmune disease that include either thyroid dysfunction or celiac disease. Adults who develop type 1 diabetes, they can develop additional autoimmune disorders. However, the risk is higher for those patients, children or adolescents with type 1 diabetes. The other subtype is idiopathic. In this type, there is lack of immunological evidence for beta cells autoantibodies. So we don't have these autoantibodies, and it is strongly inherited, but it is not HLA associated. To sum up with type 1 diabetes, there is destruction of beta cells in the pancreas, and there is loss or no release of insulin. This will lead to less glucose uptake and increasing the level of glucose, which is called hyperglycemia. Let's talk now about diabetes type 2, previously called non-insulin dependent diabetes, which is not correct anymore. A good number of diabetes type 2 patients, they will need insulin as part of their management plan at some point of life. Also, they used to call it adult onset diabetes, which is not correct anymore. As we said, both types of diabetes can occur at any age. Diabetes type 1 is less common than type 2. Type 2 accounts for about 90 to 95% of all diabetes. Although the specific etiology are not known, Autoimmune destruction of beta cells does not occur in this type. In fact, there is insulin resistance and relative or partially insulin deficiency. So, what does this mean? Mainly, the pathophysiology beyond that is these patients have high glucose level in the body, like in obese people, for example. As a response, we will have high insulin secretion to compensate for that, and making the cells able to respond for this high level of glucose. This high level of insulin in the body will work at the beginning, but with time, the body will not respond to it. In other words, the cells will get used to this high level of insulin as if it is not high anymore. So, we will have what is called peripheral insulin resistance, which means there is insulin but not enough to make the body or the cells in the body react to it as before. On the other hand, as we said, this high level of glucose in the body will make beta cells produce more insulin. At the beginning, beta cells will be able to compensate for this high demands and secrete more insulin. But with time, these beta cells will get affected and we end up with some impaired secretion, which is called relative insulin deficiency. So we have some insulin secreted from these beta cells, but not enough for the glucose level to be sensed by the body or sensed enough by the body. Usually they have less severe manifestation but high risk for developing macrovascular and microvascular complication. This is mainly because type 2 diabetes frequently goes underdiagnosed for many years because hyperglycemia in the body develops gradually, as we just mentioned and explained, and at earlier stages it is often not severe enough for the patient to notice the classic diabetic symptoms, as we will explain. To sum up with the pathophysiology of type 2 diabetes, 1. We have impaired release of insulin at beta cells level. 2. We have insulin resistance peripherally, and these two effects will make the body unable to sense the increased level of glucose, and this is lead to the liver making up more and more glucose. As the end result, we will have hyperglycemia in the body, which is the definition of diabetes mellitus. So what are the symptoms of diabetes? The classical symptoms of diabetes are polyuria, polydipsia, and polyphagia. Polyuria means frequent and increased urination. Normally, the filtered glucose in the kidney will be reabsorbed almost 100%. But high glucose level in the body, as with diabetes mellitus, will exceed the kidney capacity to reabsorb the glucose. As a result, the kidney will lose the excess glucose, and this will draw the water with it by osmosis, which leads to excess and frequent urination in diabetic patients, which is polyuria. Polydipsia, which is excessive thirst, is mainly triggered by polyuria. For polyphagia, which is excessive hunger or increased appetite, this is because the glucose in the blood is unable to enter the cell since there is no enough insulin for that glucose, so the cells will not get the needed energy, which makes the patient more hungry. The point here is that more eating will build up more glucose in the body, while the problem is with the insulin level, not with the glucose level. So will not increase the uptake of glucose, so the patient will continue feeling hungry most of the time. Also, patients with diabetes may feel fatigue. Also, they might present with macrovascular or microvascular complication. This is mainly with type 2 diabetes, or they might present with ketoacidosis as in type 1 diabetes. These two we'll talk about later in more details. In fact, there are more symptoms of diabetes like weight loss, recurrent infection, or skin manifestation like acanthosis nigricans, or non-specific symptoms, which is one of the main causes of high percentage of undiagnosed or underdiagnosed diabetes, as we mentioned earlier. As a summary for both type of diabetes, one, the primary defect in diabetes type 1 is autoimmune destruction of beta cells, while in type 2 diabetes, we have increased peripheral insulin resistance and we have progressive beta cells failure or impaired release of insulin. The onset usually in diabetes type 1 mostly in younger age, younger than 30s, while in type 2 older age, more than 40. But as we said, both types can occur at any age. For the prevalence or incidence between gender, type 1 almost equal between female and male, while in type 2, female twice as male. Diabetes symptoms almost similar in type 1 and type 2. The difference here that, as we said, type 1 diabetes might present as ketoacidosis, and type 2 diabetes might present with the macro or microvascular complications. Obesity is highly associated with type 2 diabetes, and it's less associated with type 1. As you can see here is less than 24%, while in type 2 diabetes, almost all patients either obese or have central obesity or increased lipids in the body. Type 1 diabetes is strongly associated with HLA, and for affected relatives, it's almost in 5 to 10%, while in type 2 diabetes, it is almost reaching 90% of relatives. Type 1, we have severe beta depletion as main pathophysiology, while in type 2 diabetes, we have mild depletion of beta cells, but we have amyloid deposits. Type 1, we have insulitis, but not in type 2. For glucose intolerance, it is more severe in type 1, and it's mild to moderate in type 2. Insulin sensitivity, it is high in type 1 diabetes, while low sensitivity in type 2. As we will discuss later in other videos, type 1 diabetes, all patients will need to be treated with insulin, while type 2 diabetes, they need lifestyle modification, oral hypoglycemic agents with or without insulin. With type 1 diabetes, as we said, ketoacidosis is really common, and it can be the presentation of diabetes, while in type 2 is rare. Type 2 diabetes present more with the macro and microvascular complication. To summarize what we said in this video, diabetes mellitus is hyperglycemia due to impaired insulin secretion, either relative as in diabetes type 2 or absolute as in diabetes type 1. Also, peripheral insulin resistance as mainly in diabetes type 2. Diabetes mellitus can be classified into type 1, type 2, gestational, and other specific types of diabetes mellitus. In type 1 diabetes, as we said, there is total loss of insulin due to beta cell obstruction, which is under autoimmune process. Type 2 diabetes, there is impaired release of insulin from beta cells and peripheral insulin resistance. The main classical symptoms of diabetes are the 3 B's: polyuria, polydipsia, and polyphagia. In diabetes type 1, patients can present with ketoacidosis, while in diabetes type 2, patients can present with macrovascular or microvascular complication. These two we are going to discuss later in more details. Here are the references for this video. Thank you for watching and have a nice day.